Hi everybody, happy Sunday morning. I'm Jenny Sprung, neurosomatic massage therapist, zero balancer. I've been working on bodies since about 1996, and we're going to share the inversion table with you today. It assists in reducing back pain and can address pelvic floor health. We have our beautiful assistant, Lloyd Fisher. Come on over, Lloyd. The first thing Lloyd's going to do is set up. All of you probably have one of these inversion tables. It's gathering dust and gathering clothing. Pull it out. It can help you do all sorts of wonderful things, reduce pain, and make you feel really good. First thing Lloyd is going to do is check to make sure that it's set at his height. Each one of the inversion tables has a height set. He also has a safety belt that is connected so that he doesn't go all the way over. And we also feel for the first few times you should have a second person. Lloyd's going to get in, see how he steps on the bar, and he will slowly make sure that his ankles are set in. Okay, so you're going to bend down and close up this so that it grabs his ankles. Yep. And there's a little knob right there, and he'll pull it up and let it drop down so that it really grabs his ankles even better. Good. Okay, is that where you usually have it set, Lloyd, for safety? So now I would like to address pelvic floor health first. I talk in on my website about several exercises and several resources that will help with pelvic floor stabilization. The first thing Lloyd's going to do is just go even, perpendicular, parallel to the floor, I mean, not perpendicular, and he's just going to stay right there and feel the viscera. His vital organs will start to soften and begin to slowly rest a little bit deeper, and then he's going to just, as he's holding on, notice how he holds on, he's going to go just a little bit further and stay right about here. So his head's slightly lower than his feet. His vital organs will start to move even further up into the rib cage. And this is when pelvic floor health can be improved tremendously. If you're a woman, you can use the vaginal femtone weights. If you're a male, you're going to do both. Both are going to do the same thing, with or without the weights. You will start to squeeze the perineum, the pelvic floor, and the anal triangle, and squeeze it like an elevator from floor 1. Just slowly keep squeezing all the way up to floor 13. And then you can go just a little bit further. The head can go down, but that's about it for pelvic floor. And you can even just stay anywhere in between, parallel to the floor or a little bit lower. And breathe there while you do the elevator pelvic floor work. Start to feel the viscera roll up, and as the viscera and all your vital organs start to roll up into the rib cage, the inversion table will want to even fall more toward the head. The gravity will just take you over. And we can also talk about decompression of the spine and the vertebra of the spine. And just allowing this to settle creates space and openness between each vertebrae. The first time you do it, you'll want to only do it for a minute or two and make sure you have someone there, your safety belt is on, and the size, height, and all positioning is correct. Lloyd is going down a little bit more. And now, if you would, please start to come up to parallel to the floor. Yep. And stay right there for a minute. Don't go down with the feet yet. You always want to let the body stabilize a little bit so you don't get dizzy. And then you can slowly bring your feet back down. You never want to go perpendicular to the floor. You don't want the head to be all the way down, and you can slowly let yourself get off, Lloyd, whenever you're ready. It's not necessary to do an extreme inversion. Once you've gotten used to it and you're sure you're safe and you've done it many times, then you can do more of a full invert. But for now, we thank you, everybody. Take care, and we will check in again with you shortly.